Preparing to have a baby at the hospital. This video will tell you all about what to expect when you come to the University of Vermont Medical Center to give birth to your baby. We will share advice on preparing for birth, getting to the hospital, and what it will be like when you get there. We want you to be able to give birth safely and in the way that feels best for you. After watching this video, you may have more questions. You can talk to your doctor or midwife during a prenatal visit to get all the answers you need. Prenatal visits are the appointments you have while you are pregnant. Before coming to the hospital. There are 3 things that are important to do before you have your baby. Choose a doctor who will take care of your baby after you go home from the hospital. Doctors who specialize in taking care of children are called pediatricians. Your doctor, midwife, or social worker can help you choose a pediatrician. Get a car seat for your baby and have it properly installed or inspected by a car seat technician. If you are planning to breastfeed your baby, it is a good idea to get a breast pump. Women use breast pumps for a lot of reasons. So they can store breast milk to feed their baby when they are not with them, so they can increase their milk supply, or to ease breast pain. Most insurance companies will pay for your breast pump. It is a good idea to get your pump before the baby is born. If you need help with choosing a doctor for the baby, getting a car seat, or getting a breast pump, talk to your doctor or midwife during a prenatal visit. They can help you. It's also important to think about who you want to have with you during the birth of your baby. You can have up to 3 support people with you. In times when there is a lot of illness in the community, like cold and flu season, we may have to limit the number of support people and visitors. If your support person is sick, they may be asked to wear a mask or to not come into the hospital, depending on how sick they are. There are some things you should bring with you when you go to the hospital to give birth. We recommend bringing your own toiletries like shampoo and toothpaste, but we can also give you these things if you need them. You will need to bring clothes for you and your baby to go home in, some extra baby blankets, your cell phone and charger, and any other personal items you would like to have with you. If you think that your labor has started and the baby may be coming, you should call your doctor or midwife before coming to the hospital. Call the clinic where you have been receiving care during your pregnancy. On weekends and at night, there is always someone from your doctor's office available to talk with you. Your doctor or midwife will help you decide when it's a good time to come to the hospital. Your doctor or midwife will let the hospital know that you are coming so that the nurses are ready for you in labor and delivery. This is where you will give birth. Getting to the place where you will give birth. You will need to plan how you'll get to the hospital when it's time to give birth. You can drive in your own car, get a ride with a friend or family member, take an Uber or taxi, or take the bus. If you feel the baby is coming quickly, call 911 for an ambulance. When you arrive at the hospital, there are 2 places you can park: the parking garage or the emergency department parking lot. If the baby is coming quickly or it is after 9 p.m., you can park in the emergency department parking lot, and the emergency staff will bring you up to the labor and delivery unit. If you park at the emergency department, your support person will need to move the car to the parking garage once you are settled in your room. In all other situations, you should park in the parking garage under the hospital. Follow the signs to the parking garage. You can park on any level, but remember what color level you parked on. It can be helpful to take a photo of where you park. From the parking garage, take the elevator to the 3rd floor. Walk across the lobby to the blue hallway. Turn right to walk all the way down the blue hallway to elevator E. Take elevator E to the 7th floor. When you get out of the elevator, walk down the hallway on your right. The doors to labor and delivery unit are always locked. Ring the buzzer to speak to the staff. Tell them your name and they will open the door for you. When the doors open, walk down the hallway to where the nurses are. This is called the nurses' station. It is where the nursing staff will be when they are not in your room with you. If you want an interpreter, say interpreter in English and then say your language. The nurse will call an interpreter on an iPad. You can also ask them to see if an in-person interpreter is available. Remember that having an interpreter is your right, and it's important that you can understand what your healthcare providers are saying. Tell them what you feel and what you need, and ask them questions. Before going to your room, you will sign forms that give the hospital permission to care for you and to bill your insurance company. We will print an identification bracelet and ask that you wear it while you're at the hospital. You will be introduced to your nurse and brought to your room, the labor and delivery unit where you will give birth. There are 11 rooms on labor and delivery. Most of the rooms have a bathtub and shower in the bathroom. One room has a large tub in the birthing room. If you want to learn more about having your baby in the water, you can talk to your doctor or midwife at one of your prenatal appointments. During your pregnancy, there may be times you need to go to labor and delivery for an evaluation. In many cases, if everything is fine with the baby and mother, you will be sent home. These rooms are called evaluation rooms. Your room. When you get into your room, you will be offered a gown to change into. You may choose to wear the gown or keep your own clothing on. Labor and birth can be messy, so wear clothing you don't mind getting blood or other bodily fluids on. Next, your nurse will attach monitors to your belly to check the baby's heart rate and your uterus contractions. The monitor at the top of the belly provides information about your contractions, how often they are coming, and how long they are lasting. The monitor on the lower part of the belly gives us information about the baby's heart rate. If you are in labor, after about 20 minutes of monitoring, we will decide whether the monitoring will continue or we will take the monitors off and come back from time to time to listen to the baby's heart rate. If continuous monitoring is recommended, we have wireless monitors so you can still walk around freely, change positions frequently, and use the shower or tub. The same information that you see on the monitor in the room is also visible on the monitors in the nurse's station, and we are always watching, even if we are not in the room with you. After the nurse puts the monitors on your belly, we will check your blood pressure, heart rate, temperature, and listen to your lungs. This is done frequently while you are in labor. Your nurse will be in the room with you often. The nurse will write down what happens during your labor and what care was provided in your medical record. Your doctor, midwife, and nurse want to do everything they can to help you have a safe and healthy birth. If there are things that are important to you for your birth, we want to know about it. Please share any preferences you have with us. Your background, culture, religion, and family structure can guide your preferences, and we need to hear from you what's important to you. We want to work with you to help you have the type of birth you are hoping for while always keeping you and your baby safe. These are some of the things that will be in your labor room. We have special beds in labor and delivery. It's important to balance rest and movement when you are in labor. These beds can support you in many different positions so that you can be active when you are in bed. Our labor rooms have tools like birthing balls, birthing stools, and squat bars that can be used during labor and while you are pushing. Ask for help if you want a nurse to show you how to use them. Not everyone will have an IV during labor, but there are many reasons why it may be recommended for you to have an IV. We use IVs to give you medications and also to help you stay well hydrated. If the medical team has any concerns about you or your baby's safety, we will recommend placing an IV. We have beds that are just for babies. These beds provide warmth and are also where we will care for your baby if they need help right after being born. Some babies may need to have fluid sucked out from their mouth or nose, and some babies need extra oxygen after birth. This is also where we weigh the baby and carefully examine the baby after it is born. The people who will take care of you. We work together as a team to take care of you. These are the members of your team in the labor and delivery unit. Nurses. You will always have a nurse caring for you. There may be times when more than one nurse is helping care for you and your baby. You can expect to have multiple nurses caring for you and your baby during your time in the hospital. Nurses work in 8 to 12-hour shifts. Doctors and midwives. One of the doctors or midwives from the office where you get prenatal care will be overseeing your care while you are in the hospital. You might not see them when you first arrive at the hospital, but you will see them when you are in active labor. Residents. Your doctor or midwife works together with a resident doctor. These are doctors who are doing a specialized training in pregnancy and birth. Anesthesia. We have a team of anesthesiologists on labor and delivery. These are the doctors that provide pain medication if you choose to have it or if you have a surgical delivery. It is very likely that the anesthesiologist will meet with you in your room, whatever you decide. This is an opportunity for you to ask questions about pain management during labor. It is always your choice to receive pain medication or not. NICU team. Next door to labor and delivery is our neonatal intensive care unit, or NICU. The NICU is staffed with doctors and nurses who are trained to provide specialized medical care for newborns. There are many different reasons why a baby may need specialized medical care. Volunteer doulas. We have a team of people from the community who are trained to provide support during labor. Doulas are not medical providers. They are there to give physical and emotional support to the person giving birth and their family. If you think you might want a doula to support you during labor, ask your doctor or midwife about it during a prenatal visit. Students. UVM-MC is an academic medical center, which means we are a teaching hospital, and there are many learners on our team. We appreciate the opportunity to have students involved in your care, and we also understand that birth is a very intimate and private experience for you and your family. It is up to you to decide if you would like to have students involved in your care. If you have questions or concerns about working with students, it's best to discuss this with your doctor or midwife in a prenatal visit before your delivery. Different ways of giving birth. There are different ways to give birth at the hospital. In most cases, labor contractions will start on their own. When you feel your contractions start, you will call your doctor or midwife to let them know. You can usually spend some time at home while you are in labor before coming to the hospital. If you feel the baby coming quickly, you should go to the hospital right away. In some cases, your doctor or midwife may recommend not waiting for your body to go into labor on its own. There are different methods used to help contractions begin. This is called an induction of labor. This is something that many families have questions or concerns about. It is best to talk to your doctor or midwife anytime about your concerns. Cesarean section or C-section is a surgical birth. There are many reasons why your doctor or midwife might recommend a C-section. It could be scheduled before you are in labor, or it could be recommended at some point during your labor. Your healthcare team will talk to you about their concerns and recommendations and answer your questions. They will also ask you to sign a form agreeing to the surgery. Sometimes emergencies occur in labor, and for the safety of the mother and the baby, there may not be time for a long conversation. This is something that many families have questions or concerns about, and it is best to talk to your doctor or midwife about these concerns during a prenatal visit in the clinic. We usually allow one person to be with you in the operating room during the surgical delivery. There are rare times when we cannot allow your support person to be with you. After the baby is born. This is what to expect after your baby is born. Whether you have a surgical or a vaginal delivery, you can expect similar care in the hours after your baby is born. It is normal for your doctor or midwife to wait 1 to 2 minutes after the baby is born before the umbilical cord is clamped and cut. This allows time for blood in the placenta to transfer to the baby. Skin-to-skin contact between mother and baby is recommended as soon as possible after birth to help the mother and baby bond. If you have a vaginal delivery, your baby will be placed on your belly or chest, and your healthcare team will quickly examine the baby. In most cases, the baby will remain in skin-to-skin contact with you, and we will dry the baby and wrap you both in warm blankets. If you have a C-section, your baby will be quickly examined at the baby warmer and then brought to you and your support person for skin-to-skin contact. There are 3 medications that are recommended for your baby in the hours after delivery. Vitamin K and the hepatitis B vaccine are both injections. Erythromycin is an antibiotic ointment that goes in the baby's eyes. When you come in to have your baby, the nurse will ask you if you want them to give your baby these medicines. If you have questions about these medications, it is best to speak to your baby's doctor about these before the baby's birth. It is important to choose a doctor for your baby before it is born. If you need help choosing a pediatrician, you can ask your doctor, midwife, or nurse in the prenatal clinic to help you with this. All of the nurses are able to help you with breastfeeding if this is how you plan to feed your baby. Breastfeeding is a skill mothers and babies need to learn, and it can be challenging for a lot of people, which is normal. If you have challenges or questions, we have nurses who are specially trained in breastfeeding. They can meet with you and make sure your baby is getting enough milk before you go home. If you plan to feed your baby formula, we provide 2 types. One is made of dairy and the other is made of soy. If you have a formula you want to use, you can bring that with you. Whether you have a C-section or a vaginal delivery, most people stay in the labor room for about 2 hours after giving birth. During the 2 hours after birth, we encourage continuous skin-to-skin contact with the baby, breast or bottle feeding, and spending time with your baby. You can eat or drink whatever you want. We will also assess your comfort and offer Tylenol and Motrin if you are having pain or discomfort. If your baby is in the NICU, we will help you with visiting your baby, pumping your breast milk if that is your feeding plan, and planning for going home. Sometimes you might be ready to go home before your baby is. Babies go to NICU for a variety of reasons, including being born early, getting help with breathing, getting IV medicines, and because they were exposed to certain drugs or substances during pregnancy. You and your support person are welcome in the NICU at all times, but you must be free from sickness like fever, cough, or vomiting to enter the NICU. Moving to the postpartum unit. After about 2 hours, when you and your baby are both ready, your nurse will help you move over to the postpartum and newborn nursery unit, which is just down the hall from labor and delivery. Postpartum means after giving birth. If you have a vaginal delivery, you will go over in a wheelchair holding your baby. If you have a C-section, you will go over in a bed holding your baby with you. Just like labor and delivery, the postpartum unit is a locked unit and you will need to ring the bell to enter. If friends and family come to visit, they will need to say the first and last name of the woman who gave birth to be let in. Friends and family can check in at the nurse's station to find out the room number and location of the person they're coming to visit. In the postpartum unit, you will be able to have one adult spend the night with you, but children are not allowed to stay overnight. During the day, you can have as many people visit you as you like. If children under age 12 are visiting, there must be an adult with them at all times. There is a waiting room just outside the entry to the unit where visitors can spend time when they are not in the room with you. In times when there is a lot of illness in the community, like cold and flu season, we may have to limit the number of support people and visitors. In the postpartum unit, the rooms are set up with a bed for you, a small bed or bassinet for the baby, and a bed that pulls down from the wall for your support person to spend the night. There is a small closet for your belongings. We will provide diapers and wipes, pads for your bleeding, and blankets for swaddling your baby. If you need anything, just ask us. When your labor and delivery nurse brings you over to the postpartum unit, you will meet your new nurse. The 2 nurses will have a conversation about your birth and how you and your baby have been doing since the birth. They will talk with you about how you plan to feed your baby and what support you may need during the first few days with your baby. If you have any medical conditions, they will discuss that as well. It is your right to understand everything that is being talked about in your room. If there is no in-person interpreter there, ask the nurse to call an interpreter on the phone or iPad. This same conversation will happen each time a new nurse starts caring for you. Just like in the labor and delivery unit, most nurses in the postpartum unit work 8 to 12-hour shifts. In addition to your nurse, you will also be cared for by nursing assistants who will come into your room often to check on the health of you and your baby, help with positioning for breastfeeding, and generally provide help in caring for your baby. If you need extra support with feeding your baby, ask for help, and a nurse who specializes in feeding and breastfeeding will come meet with you. Other members of your team will be your midwife or doctor, the resident team that cared for you during labor, social workers, and case managers. Your doctors and midwives will visit you every day to see how you and baby are doing. Resident doctors visit early in the morning, and your doctor or midwife will visit later in the day. A pediatrician will also visit every day to check on your baby. You will spend most of your time at the hospital in your room with the baby. You are also welcome to walk around the unit with your baby and use the patient kitchen to get snacks and drinks. We provide small snacks like toast, yogurt, cheese, and crackers and fruit. You are also welcome to bring in food from home if you would prefer. Your baby cannot be left alone in your room. Another space in the postpartum unit is the newborn nursery. There is a nurse in the newborn nursery 24 hours a day. The nursery is used for procedures like circumcisions, baths, and weighing your baby each day and performing 2 tests. The first test is called a PKU test. This is a blood test that screens newborns for phenylketonuria, PKU, a rare genetic disorder that affects how the body breaks down protein. The test is usually performed by pricking a newborn's heel with a lancet to collect a few drops of blood. The second test is a newborn hearing screening that checks a baby's ability to hear. The test is quick, painless, and can be performed while the baby is still in the hospital. If you want more information about these 2 tests, you can ask your doctor or midwife in one of your prenatal appointments. Your baby can go to the nursery if you need to rest or take a shower. Your nurse will ask to bring your baby to the nursery for assessments and to be weighed every 24 hours, usually in the middle of the night. You or your support person can go with your baby to the nursery anytime. Most people stay in the hospital 1 to 2 days after a vaginal delivery and up to 4 days after a C-section. If this is your first baby, we encourage you to stay for the full 2 to 4 days. If it is not your first baby, some parents feel comfortable going home sooner. You will work together with your healthcare team to decide what works best for you and your family. There are some situations that can increase how many days you stay in the hospital, such as if a baby was born between 35 and 37 weeks, or if a baby was exposed to certain drugs or substances during pregnancy. While you're in the hospital, our nurses will make sure you are well prepared to go home and care for yourself and your baby. Your care team will talk to you about what to expect as you recover from the delivery, newborn bathing and care, safe sleep, and how to recognize when you need to call or see the doctor. A topic your care team will spend a lot of time on is newborn feeding. However you choose to feed your baby, we will ensure your baby is eating well before you go home. This is a good time for you to ask any questions that you have. We want to answer all your questions and make sure you and your family feel supported. Getting ready to go home. Before you go home from the hospital, we will help you complete the forms for your baby's birth certificate and social security number. We will send this information to the state of Vermont, and you can get a certified copy of the birth certificate from City Hall in Burlington. You will need to pay an additional fee to get the birth certificate. The social security card will be mailed to your home. You will need to have a car seat for your baby to travel home in, and you'll need to know how to safely install the car seat in the car before leaving. When you are preparing to go home, the nurses will make sure your baby safely fits in the car seat and that you know how to buckle them in. Before going home, we will ask if you would like to have a nurse come visit you and your baby at your home. They will call you within a few days of going home to see what your questions and needs are and let you know what is paid for by your insurance. Before going home, we will also ask if you have a safe sleep space for your baby at home. If you do not, we will provide you with a portable crib for your baby to sleep in at home. A safe sleep environment for your baby is a sleep space without anything that could prevent their ability to breathe. You can learn more about safe sleep by talking to your baby's pediatrician. Once you are home, you will need to take your baby to the pediatrician within the first day or 2. Your pediatrician will call you after you go home to schedule the appointment. Your pediatrician will work with you to look after your baby's health and development. This includes answering your questions about taking care of your baby, vaccinations to prevent childhood diseases, and information about your baby's development, like sitting up and smiling and walking. They will check in with you about how you are doing and ask about social needs, such as if you have enough food at home. You can ask them questions about your baby's health and how they are growing. Remember, it is your right to have an interpreter during all conversations with your healthcare providers. Ask for an interpreter whenever you want one. We hope this video has been helpful to you as you prepare to give birth. If you have questions after watching this video, you can discuss them with your doctor, midwife, or pediatrician at your next visit.